Can you tell us a little bit more about dental implants and how do you utilize it in your care?
Absolutely. So dental implants are very common in today's practice. So it's basically a titanium or titanium zirconia screw, and it's placed into the jawbone under local anesthetic. It usually takes anywhere between 3 to 6 months for the bone to fuse around the threads of the implant. So the implant is basically, think of it as like the root of a tooth. So we're building the foundation, and then I would refer the patient back to you, for example, to build the crown on top of the implant. So anything to do with, underneath the bone and the gums, then I would do that part, and then we would work together to complete the process. So you would build the tooth on top. The implant success rate is about 97%. So they are very predictable. Most implants that fail do so in the first roughly 18 months after placement. And most failures that occur, sometimes it's bad luck, sometimes it's soft bone quality, smoking is a factor, certainly, or sometimes it's just the individual's immune compromised or takes certain medications that would affect their wound healing. If an implant fails, it means that it's loose. So it means that the bone never formed around the threads of the implant, or if they did form around the threads of the implant, that fusion got severed for some reason. So once that happens, you need to remove the implant and redo the process. Fortunately, it's really rare. So most implants are very successful. Once an implant has succeeded, usually the primary causes that it would fail is gum disease or periodontal disease. So you do have to maintain an implant the same way as you would any other tooth in your mouth. Twice daily brushing, twice daily flossing, 3 to 6 month hygiene recalls.
I mean, more and more dental implants has now become sort of the go-to in terms of single tooth replacement, even within my practice now, because I always tell patients, with any other option, you're still relying on natural tooth structure to replace a tooth. And with a dental implant, you're only dealing with, basically ceramic and metal. You're never going to get a cavity on it. The only way that you're going to lose that dental implant is if you don't take care of it like the rest of your teeth because of gum disease, like you said.
Right.
So in terms of longevity, that dental implant's meant to last. And definitely it's more of an upfront cost in the beginning, but in the long run, it'll probably cost you less because you ideally would never have to replace it.
Exactly. And I completely agree with that. More and more individuals are opting to proceed with an implant. And certainly if I was, to have a tooth that went missing, I would opt for an implant. I think it's the closest thing that we can offer to your own tooth structure at this point. And I completely agree with you. You're not relying on adjacent teeth. You're not stressing adjacent teeth. It's a single entity, and provided you maintain it, you are expected to have that implant for the rest of your life. So it is a good replacement measure. And they can also be used to help support for individuals who are missing multiple teeth. You can also use multiple implants to support bridges or to support dentures. So there's many uses for those implants.